Welcome back on this Tuesday, and once again, welcome to all the moms out there who dropped their kids off today. We know it's kind of a tough thing, so sit back, relax. We have a great show for you. Dr. Mark Crispin from Crispin Plastic Surgery has been helping his clients look and feel their absolute best for more than 2 decades now. I say more than, but it's 2 decades, right?
2 decades.
Fantastic, and he joins us now to talk about being in business for that long and how he can help you achieve the look that you want. Congratulations and welcome back.
Thank you so much. Glad to be here.
Well, for anyone who is not familiar with you, let's give them a little background on who you are, how you got started, and actually how things have changed in 20 years.
Well, when you look at plastic surgery and plastic surgeons in general, you need to look at a couple of things that are important. One is experience, and the other is training. Now, when it comes to experience, you want a plastic surgeon who is sage enough to have some gray hair, but not so old that they don't have any hair. So exactly. Somewhere in between is kind of important.
Right.
When it comes to extra training, of course, you need to find a board-certified plastic surgeon. That's very important. We all know to check that box. A lot of plastic surgery is not cosmetic surgery. It's very laudable and important stuff, but a lot of plastic surgeons don't do a lot of cosmetic surgery. So it's also important to find people who may have additional training in cosmetic surgery, and that's a good part of the whole equation.
Okay, so say that again. So you could be a plastic surgeon but not have the proper experience in cosmetics. So
you may be somewhat inexperienced in that. That certainly can happen. So they have different fellowships that are available that you can do extra time in to try to learn a little bit more about cosmetic surgery.
Sure, and talk to me about your training.
Well, I had the good fortune to spend a year at one of the New York University affiliate hospitals in New York. 20 years ago, where I was afforded the ability to do quite a bit of cosmetic surgery.
Hey, looking good,
That's
doctor.
maybe 200 years ago.
No, that is
exactly.
not.
So that's 20 years ago, a picture there. At any rate, so I was exposed to quite a lot of cosmetic procedures, got to do quite a bit of that, and it allowed me to hit the ground running 20 years ago when I came to Atlanta.
And do you see, I mean, I imagine the difference in the technologies and what we are able to do now and recovery times. I mean, this is something that's only a beneficial thing for all of your patients, right?
Yes, this is an exciting time to be in plastic surgery. Technology has done so many wonderful things for us. For instance, we now have non-invasive sort of procedures, injectables that are quite helpful.
Yeah.
Fat has gotten a lot of press. A lot of people talk about fat injected into the backside.
Right.
It also can be injected into the face to make you look more youthful, and it also has longevity to it. Additionally, breast implants have changed around. 20 years ago, we sort of had one implant that was saline, and that sort of fit every person. It didn't. So now we have all sorts of tailored implants that are much more specific for the patient's frame, and that's really important.
And I know that we have some surgeries. I want to make sure we get to some of the pictures because you do such amazing work, and everybody loves to see befores and afters and the kind of dramatic results. So talk to me about this facelift.
Well, this is a nice lady who has some facial aging. You can see the extra skin about her lower neck, and that needs to be improved. She's a pretty lady. She just has some extra skin that we were able to lift up. And you hide those incisions around the ear line, so they're not very noticeable.
Yeah, just beautiful. Look at the difference in the before and the after, and just that nice silhouette now, and how the difference it makes in the toned and the tightening of her neck.
Makes her look more rested, basically. Yes. That's the operative word we try to shoot for.
Okay, next, a tummy tuck. So many of us, we have the babies, and they just can't lose it.
Exactly. So this young lady is an attractive lady who had a baby and just could not lose that extra bit of skin despite a whole lot of exercise. So we did a tummy tuck on her, and you can see the difference here.
Beautiful.
So, we tightened up the muscle and took away the extra skin, and it seemed to help her, and she got a good result.
Amazing result, I'd say. Not just good. I mean, that's incredible. And then we also know a lot of popular procedure, again, whether you're a mom or not, whether you just want to get your breasts enhanced, uplifted. Obviously, this is a popular procedure in the office, right?
It is a popular procedure. This is the same sort of thing. This lady had a baby. She'd gotten a little stretch, had a little droop to her breast, and wanted to have a more youthful looking breast.
Ah, beautiful. Wow.
So that's her afterwards. And she does not have an overpowering implant.
Not at all.
It's a nice change, and it balances out her figure, and that's kind of what you want to do.
Right. Just beautiful, doctor. Again, it just looks like it restores her back to her youth. It wasn't too much. And now we have rhinoplasty. Popular still amongst men and women?
It's a very popular procedure, and it can be quite life-altering. This is a nice-looking fella who's just got a little bit too much pointedness to his tip.
Yeah.
And you're going to see a change here in his post-op in terms of that.
Oh, wow,
And
nice.
it's a subtle change, but it makes a big difference. In terms of his profile.
Right. Looks just incredible. Just wonderful. And doctor, talk to me about some of the things that are really hot right now in the office. What are people calling you about?
Well, there are people calling me about all sorts of things. As I said, it's a very exciting time. One of the things that we have featured is the Mirror Dry laser, which we've talked about here on the show before.
Yes.
It is a laser that stops you from sweating completely with 1 or 2 in-office sessions. There's no odor, there's no sweating, there's no deodorant, antiperspirant, so it's a really neat addendum to our practice. We've been very happy with that. So that's been a real positive as well. We've done a lot of the fat rejuvenation, as we talked about, the fat transfer, particularly in the face. It has more longevity than some of the other injectables we do as well. So.
Okay, and I know you have a wonderful offer for all of you Atlanta & Company viewers who are interested in just going into fall, looking and feeling your best. This is the man to do it. This is the practice. Dr. Crispin, tell them what that offer is.
We're offering 10% off the surgeon's fee as commemoration for the 20 years in practice, and we will look forward to being in practice another 20 years.
Absolutely. Again, that's 10% off any surgery, the surgeon's fee. 20 years in the business, as you saw the befores, and take the time to go to the website, crispinplasticsurgery.com, if you would like to learn more and see in more detail what it's all about, or just call the office to schedule a consultation now, right?
Please, absolutely.
Okay, thank you, doctor.
Thank you so much.
Thanks again, and congratulations.
Thank you.
If you would like to take advantage of that amazing offer or to learn more, please call 404-257-9888 or log on to crispinplasticsurgery.com.